Hi everyone, welcome back to Face It with Dr. G. I'm so excited to talk to you all today about our onboarding process at GFaceMD. So we're going to talk a little bit about the business side, and my way is not everyone's way, and maybe it's not the way for you, but maybe you'll take something away from my process that can help you in your business and help you grow and flourish. Maybe if you have ideas, comment on this or send me a DM to GFaceMD on Instagram and we can have a discussion. So when I built GFaceMD, I had a vision of creating a community of incredible individuals that I could grow and develop into amazing providers. And that can start with experience or without experience. And I've had people on the team and do have people on the team now that I've grown and built that have no experience, and then I have some that do have experience. And they both have different benefits, essentially. If you have experience, I look at that as a positive. Maybe your techniques aren't exactly what I do, but at least you have presumably have some foundational knowledge that gives you a couple building blocks where you can build from. If you don't have experience, that's totally fine too. I love bringing people on the team that are excited and eager and enthusiastic and passionate about learning and growing and developing new skills. I think it's fantastic. And when we do it that way, we don't have any potentially bad habits or maybe principles or beliefs that I need to redirect in someone's mind that maybe aren't exactly what we do here. They're both okay. So instead of initially having assistants at GFaceMD, I only hired potential providers, RNs, NPs, PAs. And I love that approach because it allows you to really learn and grow as you assist me. So my first nurse, she assisted me, and that's really how you learn. I look at it almost like a residency program, and that assisting lasts for a year or more. Obviously, as that provider grows and learns techniques and starts seeing patients, they are less available to directly assist me, and that's where we get into a little bit of a juggling aspect to the business, and I'll talk about that a little bit more. But I loved having providers that were learning and growing assist me. And we have a whole onboarding process of intensive training and onboarding for 4 weeks that are specifically laid out for those 4 weeks, and what you're going to learn from the medical perspective, from preparing product to documentation, before and after photos, social media. So everyone that's a provider is required to have a social media account that's owned by GFaceMD to post and grow themselves and make themselves unique and known. So you'll learn the medical side for those 4 weeks, and then also the business side for those 4 weeks. After that, those providers are able to assist me and any other more advanced injectors to gain knowledge and expertise. That process goes until about 3 months, when I am able to say, okay, you're clear to now start doing skin health treatments, which is how they also build themselves. So dermaplaning, chemical peels, microneedling if they're eligible to do that, laser, hydrofacial. So that's how they grow themselves even more. And when they're not doing those treatments, they are directly assisting me or another advanced injector. So they're continuing to grow. And there does seem to be a little bit of an issue where I don't want my injectors to be dermaplaning all day long when they're not learning from me. And I'm still trying to figure out how to perfect this, but making sure that I have devoted time for education and training and hands-on injecting with providers as they grow, as well as allowing them and giving them the time to do the treatment. So I haven't perfected that yet, but that's how we do it. Some of my providers who have had experience are able to inject earlier or do skin health treatments earlier, down to maybe 2 weeks to a month, which is great. So everybody's a little bit different, but I do have a timeline of where we have check-ins and kind of approvals for different treatments that they're able to offer. What else? So after I realized, okay, this is awesome, I have some amazing injectors here, now we really need a true medical assistant that is a rock star. The medical assistants here are so incredibly important. They have more jobs and more roles than anybody, but I didn't always have one. And now I really believe that they are so beneficial if you're in the right time in your business. So Our medical assistants do everything from intake, documentation, they take payment, they do before and after photos, social media. The list goes on and on and on. So I believe at this point, everybody's different, and maybe it's not the right time for you. Maybe you want to bring an injector on. So take them in under your wing, start training them, have them in a residency program where you grow them. And then once you get busy enough and you feel that you need a right hand, like a medical assistant, add them to your team. They're very valuable, and they add a lot to the whole experience as a patient as well. So that's how we do things here. I also have people come in to do trainings, which we love because that allows the whole team to learn. It allows a community to develop here locally, even though we have people that fly from California for 24 hours just for a training. So I love to do that, and truly create an atmosphere where people thrive, people have those fundamental building blocks and knowledge to grow and learn and evolve and really enjoy it. So my way is not for everybody, but I get a lot of questions about how I've done what I've done and how I grew to this point. And as we continue to grow, I'm not perfect. I've made mistakes. I would love this to be interactive, which it's not. You guys are just listening to me or watching me right now. But I would love to hear your thoughts or feedback on how you have grown your business or what questions you have. So I hope this was helpful, and I hope you're following along. If not, hit subscribe, and I will see you guys soon.